aa.RELL. And this is me in human form. Well, this is me in my Animaker character. I'm going to use this character in my simple explanation about botulism. Good day everyone. This is Nurse aa.RELL again in Ireland for my health news update. Last September 2023, the Health Service Executive or HSE stated that a small number of Irish individuals have been treated in French hospitals for botulism, after an epidemic linked to a wine bar in Bordeaux, which took the life of one woman. The HSE confirmed further cases in the French city, where thousands of rugby fans travelled to see Ireland play Romania in their Rugby World Cup pool game on Saturday. The cases are all linked to people who ate sardines at the Chin Chin wine bar in central Bordeaux. The HSE's Health Protection Surveillance Centre or HPSC Director Greg Martin reassured the public that botulism is not contagious.
It is important to emphasize that this advice only applies to those who ate sardines at the premises during the time specified. There are no other circumstances in which a person can be affected by this incident. Botulism can be a serious and potentially fatal condition. Symptoms include blurred vision and difficulty in swallowing and speaking. But sometimes diarrhea and vomiting can occur. The disease can lead to problems with vision and paralysis.
I'm now back in the nursing home as a nurse educator to briefly explain to you about the disease botulism. Botulism is a potentially fatal neurological disorder caused by a toxin produced by the bacteria Clostridium botulinum.
Food botulism is the dominant form of the disease, and symptoms of paralysis generally appear after incubation of 12 to 36 hours, following consumption of the toxin-containing food. Patients frequently require acute care, and 5 to 10% of those suffering from the condition die. The gram-positive, rod-shaped, spore-forming, obligate anaerobic bacterium Clostridium botulinum develops an exoneurotoxin that has systemic effects that cause botulism, a neuroparalytic disease. Clostridium botulinum is a heterogeneous and ubiquitous group of bacteria, usually divided into 4 groups. Groups 1, 2, 3, and 4, based on physiologic characteristics. Clostridium botulinum is easily isolated from soil, marine sediment, seafood, fruits, and vegetables. It forms heat-resistant spores that germinate in anaerobic, substrate-rich conditions to grow into toxin-producing bacilli. Botulinum neurotoxin is considered the deadliest toxin known due to its high potency and lethality, with a lethal dose of 1 nanogram to 3 nanograms of toxin per kilogram of body mass. The flaccid paralysis of botulism is the result of irreversible inhibition of acetylcholine release at the presynaptic nerve terminal of the body's neuromuscular junctions. Botulism can be acquired through exposure to the preformed toxin via improperly stored food, iatrogenic injection, or bioterrorism, or it can result from the systemic release of the toxin in vivo, as in the cases of infant and wound botulism. And now, let's see the signs and symptoms seen on patients with botulism. It first affects the nerves in the skull, causing impaired or double vision, difficulty swallowing or speaking, drooping eyelids, facial paralysis, and tongue weakness. As the toxin spreads, the respiratory system and lower body muscles become affected, then followed by more weakening in the arms and neck. Respiratory problems may be severe enough to need ventilation in hospital. Patients often do not lose consciousness or sensory function, nor do they typically develop a fever. When botulism is caught from food, then nausea, vomiting, diarrhea and abdominal cramps also occur. Before we proceed, I will give you first some fun facts about botulism. In 1820, Justinus Kerner published the first description of clinical botulism. based from his clinical observations of local outbreaks of sausage poisoning. Thus, it was called after the Latin term Botulus, which means sausage. As the pioneer of botulinum toxin therapy, Kerner gained fame for his suggestion that the toxin may be used therapeutically. It took 80 years for the isolation of bacteria and toxins. The bacterium Clostridium botulinum is the same bacterium that is used to produce Botox, a pharmaceutical product predominantly injected for clinical and cosmetic use. The strongest bacterial toxin is botulinum toxin. It blocks the cholinergic stimulation of the salivary, tear, and sweat glands as well as the cholinergic neuromuscular stimulation of muscle. Botulinum toxin poses a major bioweapons threat because of its extreme potency and lethality, its ease of production, transport and misuse, and the potential need for prolonged intensive care in affected persons. Members of the Japanese cult, Om Shinrikyo, tried but failed to use botulinum toxin as a biological weapon. Here are 2 priority nursing diagnoses associated with botulism. First is ineffective breathing pattern, related to neuromuscular impairment and respiratory muscle fatigue. Symptoms of botulism usually start with weakness of the muscles that control the eyes, face, mouth, and throat. This weakness may spread to the neck, arms, torso, and legs. Botulism also can weaken the muscles involved in breathing, which can lead to difficulty breathing and even death. According to NANDA International, the official definition of ineffective respiratory pattern is a deviation from normal breathing patterns as evidenced by shortness of breath, cyanosis, increased work of breathing, and/or changes in oxygen saturation. It is usually characterized in foodborne botulism. Typically, patients present with rapid progression of cranial nerve abnormalities, followed by descending flaccid paralysis, which may lead to respiratory failure. The nursing responsibilities include respiratory monitoring, monitor results of pulmonary function tests, oxygen therapy, provide a calming and comfortable environment to reduce stress and anxiety levels, administer bronchodilators, mucolytics, or other medications as ordered. For artificial airway management, maintain inflation of the endotracheal or tracheostomy cuff at 15 to 25 mm of mercury during mechanical ventilation and during and after feeding. Institute endotracheal suctioning, as appropriate, and monitor secretions color, amount, and consistency. Next nursing diagnosis is risk for disuse syndrome related to paralysis. Botulism classically begins with cranial nerve palsies, bulbar symptoms, that progress to the symmetrical descending weakness of the trunk, extremities, and smooth muscle, with eventual flaccid paralysis. Disuse syndrome is a condition that can occur when an individual's mobility and physical function is significantly impaired, leading to a decrease in muscle mass and strength, decreased cardiovascular and respiratory function, and an increased risk of infections and pressure ulcers. The NANDA nursing diagnosis of risk of disuse syndrome is used to identify individuals who are at risk of developing this condition and implement interventions to prevent it. For the nursing responsibilities, it is important to inform the patient of the purpose for, and the benefits of, the prescribed exercise, collaborate with family and other health professionals. Example is activity therapist, exercise physiologist, occupational therapist, recreational therapist, and physiotherapist in planning, teaching, and monitoring a muscle training program. Neurological monitoring involves monitoring the pupillary size, shape, symmetry, and reactivity, level of consciousness, Glasgow Coma Scale, cough and gag reflex. Monitor also for visual disturbance like diplopia, nystagmus, visual field cuts, blurred vision, and visual acuity. Now, we are near at the end part of our discussion. But before that, please watch this video of a woman who suffered for 2 months because of ingesting cheese nachos that is infected with botulism.
It's been 2 months since a botulism outbreak in Walnut Grove. One man died and several others are still recovering after eating nacho cheese sauce from a local gas station.
You just don't wake up in the morning and think, I'm going to get botulism and eat cheese and die.
A Sacramento woman is one of 9 people who contracted botulism.
After 2 months in the ICU, we hear from her for the very first time tonight. CBS 13's Macy Jenkins is live in Sacramento at Sutter Medical Center with her incredible story. Macy.
Well, Adrian and Tony, Lavinia Kelly spent her 33rd birthday lying in a hospital bed, unable to move. Her family had to drop everything unexpectedly when she got sick, and they say every day they're still fighting to get back to normal.
I feel like it's been a long 2 months.
Bound to a bed in the ICU, unable to breathe on her own, a place 33-year-old Lavinia Kelly never imagined she'd be.
I've been trying to get this recovery. Being down seems like you can't go fast.
April 21st, 2017, Lavinia and her mother Dawn Kelly were driving home from work. They made a stop at the Valley Oak Food and Fuel gas station in Walnut Grove. Lavinia's sister Teresa Flores says she was so hungry she bought the only warm food she saw, cheesy nachos.
Like, that's how hungry she was. She licked the bag, basically, you know, to get the cheese off.
Days later, Lavinia ended up in the hospital and tested positive for the bacteria that causes botulism. Her 3 children and sisters spent weeks watching her in a coma-like state, unable to move or speak. Then, an Antioch man, Martin Galindo Larios, died after eating the same cheese at the same gas station.
You just don't wake up in the morning and think, I'm going to get botulism and eat cheese and die.
Back in May, Lavinia's family filed a lawsuit against the gas station and Gel Foods, the company that manufactured the cheese. But Teresa says these days she's trying to stay focused on her sister's recovery.
Just within the last few days, she's using a walker. So that's really great for her. She feels so proud.
Here they are 4 months ago. Teresa had just said yes to a wedding dress that Lavinia picked out. And while they never planned to battle botulism together, Lavinia says this fight has only made their bond as sisters stronger.
I'm so glad, so thankful that I'm alive today.
Lavinia will be going to a rehab center starting next week. Eventually, she'll move in with her sister, but doctors say it could be up to a year before she's her old self again.
Just an incredible story, Macy, and your heart just breaks for her. She is a fighter. There's no question about it. We wish her the very best of luck.
Now, we are going to explore the different diagnostic tests needed to check for botulism. If you or someone you know has symptoms of botulism, immediately see your doctor or go to the emergency room. Your doctor will ask you questions and examine you to find out the cause of your symptoms. However, these clues are usually not enough for your doctor to diagnose you because some botulism symptoms also occur with other diseases, such as Guillain-Barré syndrome, meningitis, myasthenia gravis, and stroke, and even opioid overdose. Your doctor may need to order tests to make a diagnosis. Some of these tests are brain scan, spinal fluid examination, nerve and muscle function tests, like nerve conduction study and electromyography, and tensilon test. A tensilon test is a diagnostic test used to evaluate myasthenia gravis, which is a neuromuscular condition characterized by muscle weakness. The test involves an injection of tensilon or edrophonium, after which your muscle strength is evaluated to determine whether your weakness is caused by myasthenia gravis or not. The last I will discuss is the potential treatments for botulism. Prevention of foodborne botulism is based on good practice in food preparation, particularly during heating or sterilization and hygiene. Foodborne botulism may be prevented by the inactivation of the bacterium and its spores in heat-sterilized or canned products, or by inhibiting bacterial growth and toxin production in other products. The vegetative forms of bacteria can be destroyed by boiling, but the spores can remain viable after boiling even for several hours. The WHO 5 Keys to Safer Food serve as the basis for educational programs to train food handlers and educate the consumers. They are especially important in preventing food poisoning. The 5 keys are: keep clean, separate raw and cooked, cook thoroughly, keep food at safe temperatures, and use safe water and raw materials. Botulism is caused by a toxin that attacks the body's nerves and causes difficulty breathing, muscle paralysis, and even death. Doctors treat botulism with a drug called an antitoxin, which prevents the toxin from causing any more harm. Antitoxin therapy available to healthcare providers currently exists in two forms. Heptavalent equine serum antitoxin, indicated for patients older than 1 year, and human-derived immunoglobulin, indicated for infants under the age of 1. Intubation should be considered for patients with upper airway compromise or vital capacity of less than 30% of predicted. For wound botulism, debridement and antibiotic therapy are indicated following antitoxin administration. Appropriate regimens include 3 million units of penicillin G intravenously every 4 hours, or metronidazole 500 mg every 8 hours for penicillin-allergic patients. Additional therapies include total parenteral nutrition in cases of severe ileus and whole bowel irrigation in cases of foodborne botulism without severe ileus. Some patients require tracheostomy to manage secretions, and insert Foley and provide stress ulcer prophylaxis. We have come now to the end of my discussion. Thank you so much for watching. I hope you've learned a lot about botulism. Happy holidays.